Hi. No, you have to nod your head. Okay. Hi, everybody. It's Dr. Magnifico from Jared'sFullVet.com. This is Eddie. Eddie was rescued 3 years ago as a senior pet. So he was rescued from one of our local rescues and then found a wonderful home. 3 years passed pretty quickly, and Eddie has not had anything since the time that he was adopted to the time that he came in here. He was brought in here for lethargy, anorexia, so he wasn't really moving around. He wasn't eating anything. It had been going on for almost a week. And then he stopped eating, and that had been going on for like 3 days. So when this guy was brought to me, I had the the difficulty of not having any history. So I had no vaccine history. 3 years is too long for me to tell you that you got a vaccine history. I didn't have any preventative, so no heartworm, no flea and tick, and I have a very sick, depressed, anorexic dog, which makes everything hard. It's really important and helpful for us to have a vaccine history and a good kind of understanding of what he's been treated for or what he's been protected against so that we can move forward. When you come in with what I call an empty slate, meaning no information, I have to start from scratch. So the first thing that I did was check for Lyme disease, because Lyme disease is pretty endemic around here and it causes a lot of these guys to be very sick and very depressed. He was also so big that I almost couldn't tell what was body fat and what was edema, meaning fluid kind of escaping into places that didn't belong. When I looked at his gums, he sort of had an orange hue to them, so I was really worried that his organs, especially his liver, was shutting down. He had this very depressed, very withdrawn, very sad looking face, and I was really, really worried about him. The other problem was we had a budget to manage. So we had an owner with really tight finances, and when I have an empty slate or a clean slate and don't know anything, a really sick dog, a history of about a week, and then no money, it makes it really, really hard. So one of my take-home points is if you've got a dog, please get routine care, at least an annual physical, so that we can know that your heart's been normal, your skin's been normal, your body condition's normal, your everything looks and feels normal. That's really helpful, even if that's 10 or 12 months away. Talk about preventatives, especially if you live in an area where a disease like heart disease in the south or Lyme disease in the northeast is a problem. It's really helpful to keep these guys on a preventative, and there are lots of affordable over-the-counter ones that your vet should be willing to help you with. The next thing is don't wait a week. The minute you've got a sick dog, I'm okay with maybe 24 hours of not eating or being picky, but after that it's time to go to the vet, especially if you're on a budget. The other thing is to talk to your vet about some sort of plan so that if disaster hits, you can be ready. This guy had a full blood work panel done, and his pancreatic enzymes were through the roof, really, really, really high. They were so high that they were inducing diabetes. So he is here, and he has been here for a week on IV fluids for pancreatitis. We're treating him for diabetes. I suspect there's probably some underlying Cushing's disease going on, but right now we're going to get him through the pancreatitis, which is IV fluids. And in my opinion, if you've got really bad pancreatitis, there is no other way around treating it other than hospitalization and IV fluids. He's on IV antibiotics. He's on a non-steroidal anti-inflammatory. He's on an antiemetic called Serenia. We just added another antibiotic because his pancreatitis is so bad, and he's got a bill now that's probably $1,500, and we are going to work with his dad, who is a very good client, on a payment plan. So this is Eddie, my long-term pancreatitis dog, and his dad just stepped in, so he's really happy. If you have any questions about pancreatitis or long-term care or how to prepare for an emergency, you can find me here at Jared'sFullVet.com. Are you all excited? This is Now I'm Lively. Take care. Bye.